Great. Well, thank you very much for joining us today. We're really excited to be talking with you today about this newest version of the core competencies for public health professionals. We're so grateful that you've decided to join us to talk about this. We're really thrilled to have a new version of the core competencies to share. And we look forward to sharing that with you and to hearing your questions and your thoughts about where we go from here. I'm going to go to the next slide, which is just our housekeeping slide. So just a few housekeeping items as we get started. We do have several hundred people in the webinar today, so everyone is currently muted. We should have lots of time for questions and discussions, and hope you will jump right into that with us. At any time during the webinar today, please use the chat box to ask questions or share your comments. We have several people who will be keeping an eye on the chat, so feel free to engage with us there. We'll also pull questions, read questions out loud when we get to the discussion part of today's webinar. And so look forward to seeing your questions and your comments at that point as well. Depending on how many questions we have, please also feel free to raise your hand if you'd like to speak during the discussion portion and ask your question out loud. We'll try to manage that as best we can as well. And if you have any technical difficulties, please send us a message through the chat box as well, and we can help troubleshoot that. The slides for the meeting today, or the webinar today, are available, and I think Abdullah will drop those in the chat box for you. So if you want to download a copy, you can grab them from there. And the meeting is being recorded, so we just wanted to let you know that, and we'll be sharing that following the live event. Great. Okay. Maybe I can change the slide. See how it goes here. Okay, so we'll just start with a roundabout introductions now that I've gotten the slides to work. So my name is Kathleen Amos. If you've been part of our core competencies revision process, you've probably seen me before, but I work at the Public Health Foundation as the Director for Academic Practice Linkages, and I do a lot of work with the Council on Linkages between academia and public health practice, and I've been involved in throughout the whole revision process as we've revised the core competencies for public health professionals over the last year. I am joined by several other members of our Public Health Foundation Council on Linkages team, and I'm going to ask them to introduce themselves as well, so you can put a face to the name as we go through today. So I'll start with the two other PHF staff who are here today, beginning with Ron.
Hello all, Ron Bialik, President and CEO of Public Health Foundation. Great to be here, and just excited to hear your responses to the revised set of core competencies. Abdullah.
Hello, everyone. Thank you for joining us today. My name is Abdullah Takir, and I'm a project associate for academic practice linkages at PHF.
Awesome. And we are also joined by several members of the Council on Linkages between academia and public health practice and the Council on Linkages Core Competencies work group. So I'd like to ask them to introduce themselves as well. And I'll start with Bill Keck, who chairs the Council on Linkages.
Well, good afternoon, everyone, or good morning, depending on where you are. It is my pleasure really to act as the chair of the Council on Linkages, and to tell you how important we think this latest version of the core competencies is. Many of you know that it's the council that developed the core competencies in the first place, and we've been doing and revising them as we thought necessary. So you're being presented with a major revision today, and a lot of hard work went into that. You're going to be hearing from the co-chairs of the Core Competencies Work Group, Amy Lee and Janet Place. But I really want to thank the staff to do this group, many dozen who time and effort.
Great, thank you so much, Bill. And as Bill mentioned, our co-chairs of the Council on Linkages Core Competencies Work Group are here as well. So I'll ask them to introduce themselves too, starting with Amy.
Hi, my name is Amy Lee. I'm professor at Northeast Ohio Medical University. And just a shout out to the Core Competencies Work Group members. This is your product, and I think it's a great product. Janet?
Okay, last but not least, for those who have been involved in this, you've seen me before, but I'm Janet Place, and I am the Director of Practice and Workforce Development at the U of SC Arnold School of Public Health. And I have been involved with the competencies not as long as Ron, but getting back there a few. And this is the most, as Bill has said, the most extensive revision that we've ever done. And I know we all really appreciate that we kind of just got the word, just go for it, because it really let us be creative, and we couldn't do that with all the help of all the work group members and all the people who have supported us, and especially Kathleen and Abdul for really pulling it together.
Thank you so much. And yes, we've had a fantastic team working on the core competencies. We always have a fantastic team working on the core competencies, but it's been really great to engage with so many of you over the last year as we've gone through this process. The core competencies work group, which provides guidance and support for everything that's done related to the core competencies, currently has around 120 members from all across the country, and we're so grateful for that engagement and that support. And as we get things going here, I also just wanted to say a big thank you to Liza Corso, Doha Madani, Michelle Carvalho, and really everyone at the Centers for Disease Control and Prevention for their support throughout the revision process as well. All of the work that we're talking about right now is funded by CDC Center for State, Tribal, Local, and Territorial Support, and we're incredibly grateful for that support, as well as really happy to have the engagement and interest from a number of centers and offices throughout CDC, as well as the Health Resources and Services Administration as we move this work forward. So you heard in our introductions two groups that I just wanted to say a few words about, one being the Public Health Foundation and the other being the Council on Linkages between Academia and Public Health Practice. So the Public Health Foundation, for those of you who are less familiar with us, we're a national level nonprofit organization based in Washington, D.C. That exists to serve the public health and population health workforce. So our mission is to improve public health and population health practice to support healthier communities. And we do this by providing resources and tools, training, and technical assistance across the country. Our work is focused on organizational development and performance improvement, and specifically in the areas of quality improvement, performance management, and workforce development. And one of the major efforts that we focus on within workforce development is that we provide the convening and staff support for the Council on Linkages between academia and public health practice. So the Council on Linkages is a consensus-driven collaborative of 24 national organizations engaged in public health that works on initiatives designed to benefit the workforce broadly. The Council on Linkages has been around since 1992 and aims to improve the performance of individuals and organizations within public health, really by fostering that collaboration between academia, public health practice, and healthcare, promoting ongoing education and training, and strengthening public health infrastructure. So as you can see from the slide, members of the Council on Linkages span a variety of professional groups and federal agencies engaged in public health and population health. And the Council on Linkages is currently focused on two major initiatives, one being the Academic Health Department Learning Community, and the second being the Core Competencies for Public Health Professionals that we're obviously here to discuss today. So with that, now that you know a little bit about us, we'd also love to hear just a little bit about you. So we do have a quick poll that has two questions. First question relates to the type of organization you're joining us from. And the second question relates to whether you use the core competencies already at the moment. So Abdul put that poll up, and we'd love to just hear what you think. Awesome. So we'll give people just a minute to fill that out. Fantastic. People a few more seconds. Still have votes coming in. Awesome. So we can close that and share the results. So hopefully you can all see that, but it looks like the largest group of people here today are from local health departments, about 46%. And then a pretty good split across the other, so 14% state health department, 14% federal, 14% academia. So that's awesome, fantastic. And it looks like the majority of people here are using the core competencies. About 60% are currently using the core competencies. So awesome, that's super helpful. Some context. So with that, we will dive right in. We want to start off with, as you might imagine, an introduction to the 2021 core competencies, after which, as I mentioned, we should have some time for questions and discussion. And we really look forward to hearing your thoughts, any reactions to the changes in the core competencies and how they might impact your work, any of that kind of stuff. And please feel free to share questions or comments throughout in the chat box. And as I mentioned, we'll be watching those as well and are happy to engage there as we go through the session. I'm not looking at the chat box at the moment, so I don't know if it's there yet or not, but if it's not, Abdullah will drop the link to the core competencies into the chat box as well. So feel free to put those online. Awesome, thank you, Janet. So one longstanding initiative of the Council on Linkages obviously is the core competencies for public health professionals, which are a set of competencies that are designed to reflect foundational or cross-cutting skills for all public health professionals, whether engaged in public health practice, education, or research. The core competencies have been around for 20 years now. They first came out in 2001, and they're used in workforce development activities across the country, often in conjunction with more discipline-specific competencies. So you may have seen some of this data before. We always like to ground our discussion in a little bit of data about the core competencies. And thanks to organizations like ASTO and NACCHO and NIHB, we have some data related to use of the core competencies. So the most current data that's available shows that around 80% of state health departments are using the core competencies, about 60% of tribal health organizations, 45% of local health departments, 25% of territorial health departments, and around 90% of academic programs with a public health focus. So we also know that the core competencies are used in a variety of ways, including to guide the development of job descriptions and performance objectives, competency assessments and training needs assessments, education and training, workforce development plans, other competency sets, and other tools and resources to support the activities and growth of public health professionals. The core competencies also appear in major national initiatives such as Healthy People and accreditation. So Healthy People 2030 includes objectives within the public health infrastructure area related to increasing the proportion of public health agencies that use the core competencies and continuing education for their personnel. The Public Health Accreditation Board and its accreditation standards for health departments includes the core competencies in Domain 8, which focuses on workforce development and essentially requires the development of a competency-based workforce development plan, with the core competencies being given as example of a nationally adopted competency set that may be used for that purpose. For schools and programs of public health, the Council on Education for Public Health used the core competencies in developing its foundational competencies that you see in its accreditation criteria. And the core competencies are integrated into the Train Learning Network to support education and training as well, so that you can locate courses that will help build desired knowledge and skills. And finally, the core competencies have long been designed to reflect the knowledge and skills needed to deliver the 10 essential public health services. So as you likely know, since you're here, the core competencies have been under revision for the past year. We started in October of 2020, and we have recently completed that revision process and released the 2021 version of the core competencies. The core competencies are regularly reviewed and revised to help keep pace with changes in the field of public health and try to ensure that they continue to meet the needs of the public health workforce. The core competencies, as I mentioned a minute ago, were first released in 2001, although they were preceded by a set of universal competencies. And they are currently on a 3-year review cycle. So every 3 years, we have a discussion about whether revision is necessary. The core competencies have been revised 3 times now, with the current version being completed this October. So I wanted to start with a little bit of information about the revision process that led to the version of the core competencies that we have now, and some of the feedback that we got and how that impacted the revisions that were made. So the revision process, this is just our timeline as we went through the revision process. It really involved a number of stages that took place over that last year, as you can see on the slide, including a couple of open comment periods to hear feedback from the public health and population health community on the core competencies to inform revisions. As we talked earlier, revision of the core competencies is guided by the core competencies work group, which is made up of practitioners, academics, and others from across the country. And revision is also heavily informed by the public health community. So the feedback was gathered, was organized, shared with the work group. We identified major areas that we felt needed to be addressed. And that feedback was used to develop a preliminary draft of revisions, which was released publicly earlier this year in June. We gathered feedback on that draft, and that was used, again, along with guidance from the work group and numerous workforce development resources in further refining the revisions. So all of this led to the development of proposed revisions to the core competencies, which were sent to the Council on Linkages members for consideration and adoption. In terms of the revision process and the feedback process, we take feedback on the core competencies at any point, really, whenever you would like to share it with us. We're always open to that. But we did have these 2 open comment periods to really allow dedicated space to hear targeted and additional feedback. During both open comment periods, feedback was welcomed by email, online, both through public website comments as well as an anonymous comment box, through social media, and during virtual meetings, including 22 virtual town hall and other meetings. All of this led to more than 1,500 engagements with the revision process and really significant feedback that was instrumental in revising the core competencies. We also took suggestions for and gathered literature and other resources to inform the revision, which amounted to more than 120 resources. So a couple of highlights in terms of what we heard and how that led to changes in the core competencies. We sort of alluded to the fact that this was a pretty major revision, and so I think these are the areas in which you see the most significant revisions happen. So we just wanted to pull them out and talk them through a little bit. So among a variety of points, the feedback really highlighted a desire for better harmonization among efforts that impact the workforce and workforce development, to add content in a number of topic areas, and to make it easier to use the core competencies. And each of these were addressed in several ways. So starting with that desire for increased harmonization with other workforce development resources, numerous resources that are used in public health workforce development were consulted, and we really worked to try to align concepts and wording across those resources. So things like the revised 10 essential public health services, which came out last year, Public Health 3.0, the Public Health Accreditation Board's standards and measures for health department accreditation, the Council on Education for Public Health's accreditation criteria for schools and programs of public health, the domain areas that are used in the Certified in Public Health exam, the strategic skills for the governmental public health workforce, and a variety of other competency and skill sets were all consulted and rolled in as we went through this process. In addition, the Core Competencies work group has been identifying resources related to the various concepts included within the core competencies, and we're planning to create links to those resources to help supplement the content that's in the core competencies itself. Feedback received about content that was missing or not well addressed in the core competencies led to the addition of new content, as you might imagine, as well as the adjustment of existing content to try to better address those needs. So probably the most significant changes in this area really related to health equity, as well as to management and finance. Both of those parts of the core competencies saw pretty significant revisions. So the cultural competency skills domain was transformed to focus on health equity. And additional health equity content was woven throughout the other domains. The domain that focused on management and finance has also been reorganized and expanded. And then a few other major areas of focus in this part of the revisions included environmental health and justice, emergency preparedness and response, policy and advocacy, and communications. The request to make the core competencies easier to use also led to a number of changes in the revisions. And again, this contributed in a really major way to the revision and what the core competencies, the new version, ended up looking like in particular. So first, the core competencies were reorganized into a new structure and simplified. So this new structure, which you can see if you look at the competency document itself, but includes a set of competency statements that are meant to apply to all public health professionals. And those have also been simplified by trying to reduce jargon and eliminate, sort of unnecessary or overly complicated wording. This new structure has enabled a decrease in the number of competency statements within the core competencies from 92 in the 2014 version to 56 in the current 2021 version. The new structure does at the same time retain the eight domains and 3-tier structure that existed previously. Second, to assist with use of the core competencies, sub-competencies were added that articulate more detailed knowledge and skills for individuals with responsibilities related to each of the 3 tiers. So the idea was that having fewer competency statements and also adding these sub-competencies will help support both users who are interested in a more general view of the knowledge and skills in the core competencies and those who are looking for a more detailed view. Third, as mentioned, the resources will be linked to the core competencies to help supplement the content that is included in there, provide a little additional context or some tools that you might use to get started working in those areas. And the examples which appear in the core competencies as EGs have been updated to provide additional context as well. And we do plan to continue adding to and updating these resources and examples over time to help transform the core competencies into more of a living document. And finally, we're working right now on putting the core competencies online in a format that will provide more interactivity and more options in terms of how you can view the core competencies. So for instances, allowing you to see only the competency statements without all of the sub-competencies, or perhaps to see all of the detail in the sub-competencies, but only for a single tier, that sort of thing. So we're really hoping to be able to transform that a little bit more and take it out of kind of a static PDF document to something that you can more easily interact with. So obviously I'm not going to go through the whole competency set right now, we'd be here for hours, but we did want to briefly preview a few of the specific high-level changes that you see in the revised version of the core competencies. So first, I wanted to point out that there are some changes to the domains and the domain names. We still have 8, but they don't look exactly the same as they did in the 2014 version. So 5 of the domain names have changed in some way. In most instances, this doesn't reflect really significant changes to the focus of the domain in terms of content, but more changes to how the title of the domain was worded. But the biggest change, as I alluded to a minute ago, is the move from emphasizing cultural competency skills to emphasizing health equity skills. In addition, the revisions contain some minor changes to the tiers and how those are defined. So principally, these changes reflect a desire to shift from focusing on sort of categorizing or slotting an individual into a certain tier to more focusing on the different types of responsibilities that individuals have within an organization, as individuals often have responsibilities in different areas of their jobs that cut across the tiers. So that's just some of the wording in how the tiers are defined has changed a little bit. And we've also removed the emphasis on entry level from tier 1 and highlighted program support responsibilities there. So just have 2 slides here that just have screenshots of the 2 main views currently of the core competencies. And so this first one is one that shows only the competency statements. So again, we have 56 competency statements organized into the 8 domains. And as I mentioned, priority was really placed on reducing the number of competency statements and simplifying the wording to help make them easier to use. We've heard from many years, particularly from health departments, that the core competencies can be long and complicated for some of the activities in which they're being used. And so this decrease in competency statements really represents a really significant effort, I think, to try to address those needs. And this second view kind of shows you the whole thing as it looks right now. So the competency statements, along with sub-competencies and examples, organized into those 8 domains and 3 tiers. So this is a view that you would look at for that more detailed information about specific knowledge and skills for each tier, as well as examples to help provide additional context for the competency and sub-competency statements. So we're very happy that the final revised version of the core competencies is now available online. And with that, we are starting to turn our attention to providing more of the support around transitioning to this new version of the core competencies. So we recognize that it's not enough to simply develop a competency set, that there are lots of pieces that go into that implementation. And so we're now beginning to focus on that variety of resources and tools that can really help individuals and organizations implement the core competencies. I've kind of grouped these into 3 buckets that you see on the slide here. So first, as we do every time there's a new version of the core competencies, we are and will be developing resources and tools to help with that transition from one version of the competency set to another. So we are currently right now working on the crosswalk. That's typically our first step in this transition resources bucket, working on a crosswalk that shows how the specific statements within the 2014 version of the core competencies and the 21 version relate to each other. So you'll be able to see kind of where things from the 2014 version ended up in the 2021 version and what's new. And as a corollary to this, we are also working with our train team here at PHF to update the version of the core competencies that exists in the Train Learning Network and map existing courses that are tagged with those competencies to the new version of the core competencies. So that is all underway at the moment. Second, we will also be updating existing resources and tools that support use of the core competencies to reflect the changes that have been made in the new version. So we've begun this work by updating the existing competency assessments, those instruments that are available on our website. We'll also be exploring additional assessments and resources in that area, but we're starting with updating the ones that we have now, so they'll reflect the current version of the core competencies. And then third, we'll be exploring developing additional resources and tools that support use based on your feedback and other needs that have been identified. In addition to resources and tools, we'll also be offering opportunities to learn more about the revised core competencies. So we are planning to have a series of webinars and things like that to give an opportunity to ask questions and figure out what's going on with the new competency set. And we're always happy to answer any questions or provide guidance outside of those forums as well. So by email or over a Zoom chat or what have you. So we're looking forward to all of that. And that is about it in terms of the kind of high level overview that I wanted to share. Before we move into discussion question time, we would really love your input about these resources and tools as we are moving into that phase of the core competencies development process. And so we did put together a second poll that asks what resources and tools would help you use the core competencies. And again, we'd love your input as we prioritize, what to work on and in what order. So I asked Abdullah to pull that poll up. And if you have thoughts, please feel free to share them. And I think there is another option in the poll. So if your answer is other, we'd love to hear in the chat what you're thinking, what would be useful to you.
I think the one that's missing here that we hear all the time is the competency assessments. And I know there's some questions in the chat about that too. So I guess that would fall under other, but just let you know that that's definitely something that we know people want.
Yeah, that's a great point. Thank you. I didn't think to include it in the poll because we have already started that process. And I've gotten a very many number of emails from people asking for the assessments or when they'll be ready. So that's a great point. Awesome. So we'll give people a few more seconds to vote. I can see that people are still adding their input. So this will be really helpful for us in terms of prioritizing and thinking about what we work on first and what we work on next and that kind of stuff. Because we don't want to create tools just for our own sake. We want to create ones that are actually useful. And so this is awesome. We really appreciate it. So maybe you can close the poll and share the results. So it looks like we have a pretty even split here. I'm trying to open so I can see the whole thing. So looks like the largest, around 60% of people voted for the crosswalk between the core competencies and 10 essential services, which is something that we are planning on updating, both the changes to the essential services and the changes to the core competencies. That will be really important, I think.
And to remind people that the original core competencies were based on the essential services. So that's an obvious that we would go back now and make it match, because that was always part of its structure.
Yeah, absolutely. Definitely. And then the other about 60% examples of how organizations are using the core competencies. So we do have a collection of that we'll be looking at as we start rolling out as we are rolling out the new core competencies. If people have examples, we'd love to hear about the work that you're doing with those. We always love to be able to make those connections and share across the country. And then about 55% for video or slides introducing the core competencies. Tailored lists of priority core competencies for different jobs is something we've talked a lot about with the work group. So I think that will be really interesting. Crosswalk with the strategic skills, around 46%, and guidance for using with PHWin's data, about 33%. Awesome. Well, we really appreciate that, and that will be really helpful as we go through the next little while and really dig into working on those resources and tools. So with that, we should have, what time is it? We should have about 20 minutes or so for questions and discussion. So we'd love, as I mentioned earlier, we'd love to hear your questions about the core competencies, or if you have thoughts or things that you'd like to share, reactions to where we are in the process. Please feel free to continue to put your comments in the chat box. I'm gonna kick things over to Ron, because I know he's been following that as we've gone along here today, and I'm sure there are questions in there already.
There are a lot of comments and questions.
Okay.
So I'm going to do my best, but also hopefully people will chime in and speak up themselves. So the very first one, if I go way back in the questions, has to do with the more an expanded integration of law and policy in the revised core competencies and what we might do, what the council might do to help advance this in academic programs. The more public health law competencies in academia and public health professions. And my response was, good question, good thought, and that we, can indeed follow up on that. But I wanted to express that to see if any of our co-chairs or council chair or you, Kathleen, have any thoughts and suggestions about that.
Well, a lot of that, the new wording that came from obviously all the work groups, but specifically the environmental work group, since so much of environmental health is about assurance. And so that was something that I chaired that group and was very interested to get a lot more justice and law in there. As to these are the foundational competencies. I think there are CDC has public health law competencies. I haven't seen them in a while. Kathleen's nodding her head. It would be interesting, make those available to see, how they might be better incorporated.
Yeah, CDC definitely has the CDC's public health law program has competencies. We've worked with them on competencies. And I think there are a number of areas in the core competencies where we flagged the possibility of connecting. I talked a little bit about how the core competencies are meant to be cross-cutting and foundational, and we try to balance incorporating stuff with not incorporating so much that they're 500 pages long. And so one of the things that we're really looking at, which we've never done before, so I'm pretty excited about, is making direct connections to other resources and some of the public health law competencies, and some of that work that has come out of CDC is flagged for connecting the dots, if you will, as we continue to add resources and whatnot. So I'm pretty excited about that.
Kathleen, there's a question about any work to validate the core competencies. And we've received that one over time. And the quick response on that is there hasn't been a whole lot of specific research. On the other hand, through Healthy People 2030, through the ASTO and NACHO and National Indian Health Board surveys, there clearly is a good bit of use. That doesn't get into the specific ideal validation piece, but again, any of our other work group members have thoughts about that.
Mark Edgar at Wisconsin has done a lot of work in this area. I don't know if he's done anything recently, but it'd be worth, I don't see him on the call, but he was certainly involved in the work group. So maybe he would be a good person to know what's going on.
Yeah, he's definitely done some of that work on earlier versions of the core competencies. And I don't know if this is the same question or not. I'm kind of scrolling through the chat box a little. I see a note about validating settings outside of the US as well. So we do produce these core competencies for the US public health workforce, but there are lots of countries around the world who use this set of core competencies in their own work. And we get approached pretty regularly from other groups who are working on their own competency sets or interested in translating or adapting the core competencies to their own context. So we have worked or had discussions with groups in Singapore, Japan, China, Ethiopia, kind of a number of countries across the world, as well as they get used, or we were engaged in some of the revision process with the core competencies from the Public Health Agency of Canada and in the UK and things like that. So how well it works in those other settings, I don't know, but it is something that is definitely, the awareness is there, and it's really fun to engage with those other groups and see what they're working on in their own context as well.
Kathleen, this will not surprise you at all, but there are a number of people who basically say they could use the assessment ASAP.
Yeah, we're working on that ASAP.
and the follow-up to it is a question about a timeline for the development of additional resources and tools. A favorite question.
My favorite question. Yeah, I mean, the development of resources and tools is ongoing, and we're doing it at all times, basically. We have prioritized, because of the number of requests that we received, as well as feedback as we were going through the revision process, we have prioritized first revising the existing assessment instruments that we have. I know there have been a number of suggestions as well about how we could create a different assessment instruments or add to those assessment instruments. We're starting with revising the ones or updating the ones that we have now. We're hoping that should be available in early January. And then after that, that was part of the poll today, was to get a sense of like where we should focus first, because we do really want to focus on what's going to be most useful. So that crosswalk with the essential services, things like that will likely be what we turn our attention to. The Core Competencies work group will be involved in all of this. So if you're interested in getting involved and hands-on, please feel welcome to join us in that. But we'll look forward to sharing more as we get a sense as we move into the new year and really start diving really significantly into tool development.
There's a question about the crosswalk. And will we do a line listing of the changes?
Oh.
And I think there are a variety of reasons why that could be problematic, but Kathleen, you know better than anybody.
Yeah, we certainly could if that would be useful. We do have track changes versions. It's a royal mess. It's a lot. There was a lot of stuff that got changed. The wording with that change to the structure and with the change to really focus on simplifying the wording. I'm not sure there's any competencies that remain identical from what we had before. So I'm not sure how helpful it would be, but we can certainly, if anyone's interested in that, feel free to email me, and I'm happy to let you see what it looks like.
And I see a request from Kristen Ward, and a few others have chimed in saying, yeah, that would be great. Suggestions for specific trainings for staff mapped to the core competencies. And, one thing I'll say is that you can, search within Train for trainings related to the core competencies. Right now, the revised version, as Kathleen mentioned, it's not yet integrated into Train. It will be. But I'm wondering, Kristen or others, if you're thinking about something else there. So maybe you can speak up and add to that.
And if you do want to do that, if you just raise your hand, I think we can unmute you, because you may not be able to do it yourself.
While we're waiting there was also a thought about, will we be mapping to CEIF's competencies?
That's a good question. That's a good idea.
They usually map to us. That's history is always that our competencies inform CEIF.
Yeah, so CEIF
and they're part of the
right? Yeah, they used the previous version of the core competencies in developing the foundational competencies. So there was a mapping done at that point, but that's a great idea to look at.
With a question about how we considered an electronic version of the assessment tool.
Yeah, that is something that comes up a lot. And I think we'd love to do it. I think we've had various discussions with different groups about how that might be accomplished. Very much an idea in progress at this point. So if you have any specific ideas of like how you would like to see that, we've always talked about our ideal at the end of the day being an electronic version of the assessment that then links into Train as well, so that once you identified the areas that you wanted to focus on, you could easily it would automatically suggest courses or whatever that are tagged with those core competencies. So that would be awesome.
Having first developed the competency set, because way back, these assessments, they were developed as they're self-assessments for professional development rather than, for use to assess your workforce. So that's and I guess it was just, they were just done to be simple and self-scoring, but it would be great to have electronic versions.
Yeah, and there are lots of groups who do, take the competency assessment and dump it into like Qualtrics or SurveyMonkey or something like that, and to be able to aggregate the data. So it's definitely something that we've had a lot of conversations about. I don't think we've ever gotten to the point of having been able to build it so far, but who knows what the future holds. And I think it looks like, Alan, you have your hand raised. I don't know if we can unmute. If you had a question that you wanted to ask.
Has the pandemic or issues like climate change changed any of the core competencies? Have you added or changed anything as a result of that?
I just answered that to you directly too. Yes, that was the major reason for making sure that we had an environmental health subcommittee to make sure that these issues were being covered, and where you find them is in the examples. So, there are specific examples about types of data relating to measuring climate change and other. So it wasn't just data; it's the whole issues. It's policy. It's in there.
Yeah, one of the reasons I bring it up is because I work for a health department in Florida, and sometimes I get the question from people, well, how is environmental health really going to get involved in climate change? What can we do?
Yep.
Yeah, it's a great point. I'm really glad you brought it up. As Janet mentioned, so we had subgroups within the work group that focused on different areas, and one of them was focused on environmental health. And another area I think that I would highlight that really a lot of feedback that we got, and a lot of feedback related to COVID, the pandemic, really changed is the communications domain. I think there was a lot of energy went into rethinking communications as a result of that, just as one example. But the communications section, some of the stuff around leadership and systems thinking,
risk communication,
exactly. Yeah, there were a number of areas that where I felt like we got a ton of feedback and had some really good discussions that was tied into COVID, climate change, environmental justice, those sort of things. So I'm glad you brought that up.
Thank you.
Thank you. And it looks like Monique, you have your hand raised as well.
Yes, hi, thank you very much for this presentation. Unfortunately, I was tapping in and tapping out because I had another presentation going on another computer. So, that's how we multitask these days in the virtual world. But one of my strong interest area is in health equity, and in particular around culturally appropriate evaluation and just cultural based assessments, and how we're really integrating the engagement of intersections. How is that really coming out through the competencies? Like, I know you talked about the health equity side, but is there sort of a stronger emphasis now on working with across cultures and within communities on the engagement side for this new phase, as we move into this new phase of public health?
Yeah, that's a great question. I think so. I hope so. I hope we've accomplished that. I think sometimes some of the way that the competency statements are structured, I don't know how to articulate this, but so I would say you'd see the health equity domain, and we put a lot of energy as well into community partnerships domain, which has a lot of those community engagement pieces. So sometimes it's sort of combining multiple competencies together. But I think that was an area that was really a significant focus, and I think we made strides in that area. I don't know, Amy, I know you chaired the health equity subgroup, if you had anything you wanted to add, because I know you guys had a lot of conversations about this kind of stuff.
And nothing beyond what you've already said.
Well, I think, I know that I was, and the notion of the community controlling the process when you're working with the community was very much brought up, and I believe it came through in the revision and certainly with communication and all, so that was really an important aspect to get in there.
Oh, great. Yeah, that is so critical for when we start not just working with the communities, but the language that we're using. Like even at CDC, we're not even using stakeholders anymore. Like
exactly.
Yeah.
Exactly.
So things like that, just really making sure that the new generation of public health professionals are really understanding how we connect these principles together through this lens of equity and cultural competency.
Absolutely. Yeah. And speaking of a school of public health, I don't think we do it well enough. So I know that's an issue that I'm always driving forward. It's, you can't just tell the community what they need, they have to tell you and so hopefully we're making strides.
Great.
Yeah, that's why,
sorry, go ahead.
Yeah, and that's why some of the competencies were written kind of broadly. We had conversations exactly like what you were talking about. And we didn't want to, make sure we focused on any one word or any one concept, and just hope that the way that the competency is written, you would be able to interpret it in the way that you need to accomplish what you want to do.
Great. That would definitely help, because I'm actually helping to write curriculum for a new MPH leadership program, and having these competencies now and the new CEIF competencies and public health 3.0, all of this is sort of jamming together at one time. So, these different crosswalks and trainings are really going to help as we move into this new generation of public health leadership. So thank you.
Yeah, that's awesome. And if you have, as you're going through the core competencies, and for anyone who's on here today, as you're going through and really digging in and starting to use them, if you have suggestions, particularly in terms of resources that we can connect with, examples we might add, a lot of the stuff, the competency statements themselves get adopted. And so they're set for a certain period of time to give people time to, live with them and use them. And there's a lot of other competency sets that use them. So we try to be careful about how quickly or how frequently we change them, but there's lots that we can do to surround the competency statements themselves in terms of adding additional context, or we've talked about developing guidance documents for certain areas. Environmental health was one that came up about how to use this and how this can be incorporated. And so if anyone has any suggestions around things like that, don't hesitate to send them our way. Just because the new version is out does not mean that we're done, obviously.
Kathleen, I realize we're not going to get to most of the comments and questions, unfortunately, and we could do some follow-up on that, but I wanted to be sure to get two comments out there and questions out there. One is, from the experience we've had so far, staff get anxious from the revised set of public health core competencies and think they're rather intimidating. So what guidance might we have about that? So that's one. And the other is why there seems to be no difference between sub-competencies across the tiers. Like, why no progressively advanced verbiage across the tiers?
Okay. We'll try to remember the questions. So
Right.
The first one, intimidation. So we do hope, and this is one of the things that we got a lot of feedback on, and we're really trying to think through and develop new ways to look at the core competencies. So we do help being able to, or we do hope that being able to get it onto the website in a way that you can see only pieces of it will help with some of that, in terms of like not having to look at the entire 16 pages all at once or whatever, but to be able to say like, these are the 56 competency statements and only see those and not have to see all the detail if it's not helpful for what you're working on at the time. Another thing that we always emphasize is a prioritization piece. So like we have gone from 90, 92 or whatever competencies to 56, which is a lot smaller, but you're still not going to focus on 56 competencies at once, right? Like that's not realistic. And so to really think through and prioritize what's most important, depending, based on the job that you're in or the job that you're reaching for or what have you. We do a lot of work in that prioritization area, and one of the resources actually that we had in the poll, we're hoping will help with that too, of being able to like pull out, these are the 10 or what have you priority competencies if you're working in X type of position or what have you. So I think those are some of the things that we think about the most. If you want to talk more about that offline, I'm happy to do that as well, because it's something that we recognize is always a challenge with the competencies. And the second question, related to kind of that gradation across tiers, was something that we had a huge number of conversations about as we went through this process. And what we really tried to do with this version of the core competencies, and we're certainly open to your feedback as to how well we accomplished it, but we tried to focus on like what are the skills that you need if you're doing the type of work that the tier reflects. So it might be less that there is, you know, kind of, I don't know what the word is, but less of a gradation across tiers if the skill is essentially the same. So you might, you know, say take data collection, for example, you might do data collection with a responsibility related to tier 1, tier 2, or tier 3, and the actual skill that is collecting the data might be the same. It might be the type of data that you're collecting that's different, or what you're using it for, that kind of stuff. So some of it comes less, I think, in the skill itself than in how it gets applied in the real world. And so you will see some of that. There is still some gradation, so it kind of depends on what
domains have a lot of it.
Yeah, it depends on what competency you're looking at, what subcompetency you're looking at. You will see different kind of skill levels, if you will, across the tiers. So it just sort of depends on which part of the competencies you're looking at. And again, if you want to talk more about that, feel free to reach out to me. I know we're getting to the top of the hour, and so I will flick through the next couple of slides because they have my email address on them. So just to go there, we really appreciate this discussion and to hear these questions and comments. We obviously will capture everything in the chat box, and if we can help, definitely don't hesitate to say so, and we'll try to follow up if there's questions that we haven't been able to answer and things like that. But I wanted to close just by inviting you, as always, to stay connected with this work. So obviously, as we mentioned, the core competencies are online, so you can visit us there at any time. We do have a number of newsletters that regularly contain updates related to the core competencies. So the Council on Linkages update is the one that's the most focused on Council on Linkages work, and it contains regular updates anytime we have a new tool, a new webinar, or what have you. And then we also share major kind of milestones in the other two newsletters that you see on the slide here as well. So PHF eNews is focused on performance improvement generally, and then Public Health Learning is focused specifically on workforce development. So if you're not subscribed to any of those and you'd like to be, the links on the slide should help with that. And as I mentioned, we're really open to your questions. We hope you'll continue to engage with us as we move forward with the new version of the core competencies. And please don't hesitate to reach out to me with questions, with suggestions. If you want to discuss anything, I'd love to talk it through. And then these are just, we want to gather in one place some of the links related to the core competencies for your work with that. So the Council on Linkages website obviously contains information about the core competencies, as well as its other initiatives, such as the Academic Health Department Learning Community. The core competencies are available online, as are collections of core competencies tools and examples of how organizations are using the core competencies. As I think we've mentioned, at this point, these tools are all built using the previous versions of the core competencies, just because the revised version is so new. But we are working to update that, and the updated versions of the tools will be added as they are developed. So please feel free to explore our website. Everything that all the stuff we do under the umbrella of the Council on Linkages is freely available online. And so feel free to look around, let me know if you have any questions or if I can help you find anything. So with that, I will say thank you. We are at the top of the hour. So we really wanted to thank you for your participation today and your engagement throughout this core competencies revision process. It's so valuable to us, and I think Ron wants to say something.
Yeah, if I may, in the comments, there's a lot of enthusiasm and there's some anxiety. And what I'd like to say is, as Kathleen just said, please reach out to us. We often help organizations work through issues related to the competencies. And if there is anxiety, we want to help folks overcome that and figure out ways with you to do that. So please, please, please don't just be anxious. Contact us, and hopefully we'll be able to help.
Yes, absolutely. Or if you just want to chat, we like that too. So we're around. And thank you. Yes, thank you again for your participation today, for joining us here to talk about this, your engagement throughout the process. We look forward to continuing to hear from you as you start using the new version of the core competencies. And as Ron said, if there's any way we can help, definitely don't hesitate to let us know. So thank you very much. I hope you have a good rest of the day.
Thank you all for your great questions.
Yes, we love those.